Thank you for joining us for this Friday's COVID-19 press briefing. Today, Orange County Mayor Jerry O. Demings will discuss Orange County's effort in assisting the state with the vaccination process, including important dates and times for registration, a vaccination for our citizens in senior living centers, and other important vaccination information. The mayor will also give an update on COVID-19 testing, positivity rates, and he will discuss our eviction diversion program, CARES Act funding details, information from our strike teams, and more. Mayor Buddy Dyer could not be here with us today, but we do have with us Dr. Raul Pino from the Florida Department of Health in Orange County to discuss details on the vaccination process, as well as other important COVID-19 trending data and information in our area. We do begin now with Mayor Demings. Mayor?
All right, thank you, Dr. Williamson. Thank you to all of you for being here. Believe it or not, it's been about 8 days since we last had a briefing. I know that you probably missed us, but due to the holiday and a lot of other things happening, I had the opportunity to travel to Washington, D.C. to participate in the inauguration. And I want to share with you today, I released the following statement from D.C., and I really believe that it is relevant as we continue to battle COVID-19 here within our community. And this was the statement that I released to you, but perhaps some members of the community did not see the statement. What I said was this: what a privilege it was for me to attend the 59th inauguration of a United States president, along with my wife, U.S. Representative Val Demings. I was personally moved most by President Biden's promise of uniting Americans, and I believe that this approach will be more successful than that of the previous administration. I look forward to working with the Biden administration in my role as Orange County Mayor. Soon, we will see the tangible benefits to Orange County residents from the President's expected nearly $2 trillion coronavirus relief package and the $350 billion American Rescue Plan announced prior to the President's inauguration. I believe the road ahead is bright as we work to contain the pandemic and re-energize our community. My reference in this statement to the federal money is due to my recognition of the enormous dollars needed to assist our community in economic recovery from the pandemic. The total number of residents who've been vaccinated in our community, I'm going to defer to Dr. Pino. He'll share those numbers with you in just a few moments. But I wanted to really just talk about where we are. I believe that with the beginning of individuals being vaccinated in our community means that we're turning the corner to contain the virus. I'm pleased to announce the appointment portal will open at 5 p.m. today. That's in just a few minutes. In order to register for an appointment to receive the vaccine, you must be 65 plus and a resident of Florida, or be an individual present in Florida for the purpose of providing health care services involving direct contact with patients. Again, the portal will open at 5 p.m., about 20 minutes from now. The Orange County Convention Center site will go from vaccinating approximately 2,000 people a day to 2,500 people a day. Dr. Pino is here, and he, again, will provide more details about that. However, if you want information about the appointments, you can certainly get information about the vaccinations at ocfl.net/vaccine. Next week, residents will start getting their second shots of the vaccine. Dr. Pino assures us, he's assured me, that there is plenty of Moderna and Pfizer for those who will be receiving their second shots. In fact, the vaccines have been put in color-coded containers to ensure the right vaccine goes into the right individual's arm. Blue is for Moderna, red is for Pfizer. And that's the logistics associated with the convention center. I am sure the second vaccine will go as smoothly as the first. The Orange County Public School employees who are 65 years of age or older will have a closed point of dispensing, or pod. That pod will take place at the Orange County Convention Center this Sunday, January the 24th, beginning at noon. Mr. Scott Howard from the school district is here should there be any questions specifically about the Orange County Public School staff who will be eligible to receive the vaccine, again, beginning Sunday. Our Orange County Fire Rescue paramedics have been doing just an outstanding job setting up mobile vaccination sites at senior living communities throughout our county. So far, they have delivered the first shot to over 1,200 seniors at 7 locations. Today, they were at the Zellwood Station community where they vaccinated 700 seniors during the last 2 days. The paramedic teams were recently at the Gulfstream Harbor Mobile Home Park where they vaccinated nearly 500 seniors. The paramedics will continue to dispense the vaccine to those living in independent senior centers. Now we'll get to the numbers. Since the pandemic began, there have been a total of 96,841 persons who have tested positive for the coronavirus in Orange County. We will likely reach a new milestone. I am projecting that next week we'll reach 100,000 persons who would have tested positive over time in our community. Now, quite frankly, that is not a milestone that I wish to reach. But given the trends that we're seeing, the daily numbers of new cases, next week we'll hit the 100,000 mark. If there's anything promising about this is that our daily case numbers have been declining. Yesterday, 676 cases were reported. That's down from over 1,000 daily cases we were seeing just a few weeks ago. However, the disease remains deadly. A reported 893 Orange County residents have died as a result of the coronavirus. That is an increase of 70 deaths since our last briefing 8 days ago. Each week, I learn of someone that I knew who died of the virus. I ask that you pray for the families who have been touched by COVID-19. Orange County Health Services free testing sites continue at Barnett Park, which will remain open between 9 a.m. and 5 p.m. 7 days a week. Right now, we will continue testing through Saturday, January the 30th. We want to continue our testing options, however, and we're continuing to work on a strategy going forward. We hope to make that announcement next week. We ask that you visit our website at ocfl.net/testing to make appointments, to see the location. No appointments are necessary, however. Our COVID-19 eviction diversion program has helped over 3,100 individuals and families avoid eviction by providing nearly $10 million in assistance. We've received a number of questions about when the program will end. The good news is that we intend to keep the program going until we have another means of rental assistance for our residents. We know that avoiding eviction during the pandemic is on the top of many residents' minds. To that end, Orange County was allotted $33.4 million from the federal government for emergency rental assistance. This is from the $25 billion federal bill for COVID-19 relief. Our team is still awaiting guidance from the Treasury Department on the restrictions for the program and how the funds can be allotted. So stand by, we'll make additional announcements soon. We know, however, that it will be income-based and the state does not have specific restrictions on how the money can be allotted. As mentioned in previous news conferences, our Cares for Individuals and Families program has been closed and the portal will not be reopening. I want to share with you that we were successful in distributing more than $65 million to individuals and families who have been financially burdened as a result of COVID-19. These are families that received $1,000 grants each. The team is still processing a few remaining applications, and anyone who has been approved will have their check processed within the next 2 weeks. In terms of our compliance teams or our strike teams that we put in place, they have now visited over 6,600 businesses with a compliance rate of 99%. Since the citation and warning program began, we have visited 1,246 businesses and issued 91 warnings and 17 citations. Again, that goes back to when we put the fines in place beginning December the 4th. I know that it has been difficult for many people in our community to find a job. So next week, we want to make an announcement about a job fair. We want to share that Orange County government is partnering with the Central Florida Employment Council to host the 20th annual Mayor's Job Fair next Wednesday, January the 27th. So if you are looking for a job, over 40 Central Florida companies will be hiring employees in the fields of healthcare, transportation, customer service, education, construction, and others. This event is free for all job seekers and will be held at the Central Florida Fairgrounds Expo Park from noon until 4 p.m. on Wednesday of next week. For more details to learn about the safety measures that will be required in order for you to attend or participate, you can visit their website at cfec.org. Again, cfec.org. And now, Dr. Raul Pino.
Thank you, Mayor. Thank you, everyone. Welcome. So the menu mentions some of the numbers, and the data has good news and bad news. The good news is that our positivity rate is decreasing slowly, but continue to decrease over the last 14 days. Another good news is that the ER visits have decreased in the last week. Hospitalizations are decreasing slowly, but decreasing. And the bad news in the data is that the number of deaths have increased. These, as sad as it is, should not come as a surprise. As we have mentioned to you maybe 3 weeks ago, that by now we should see these numbers. Just to give you a comparison of the numbers, from December 1st to December 20th, just to compare the same period of time, from December 1st to December 20th, we had 65 deaths in our county that were due to COVID-19. In the same period in January, we have 80 deaths in the same period. That's an increase of about 23%. And as I mentioned to you before, this is a data that always lag. So if we continue to adhere to CDC guidelines in our community, if we protect ourselves at home and outside in the community, that together with the vaccination that we are conducting should quickly reduce the number of deaths, or at least the ratio that we are experiencing. For that, I really ask our community to continue to wear your mask, wash your hands, and watch your distance. Now, because the vaccine is here, it is over. We can turn this around, and I think we are turning it, but we need your collaboration and support to be able to achieve this. And also, our recovery rate has increased from last time that we talked to you was 88%, today is 91%. So those are good indications that the pandemic and the community are going in the right direction. Although, of course, for those who have lost family members and friends, these news are not of any pleasure. But the community at large, we have seen an improvement in the data. People have several concerns that I have seen in the news. I wanted to address some of them through this press conference. First, with regard to the residents' requirement to be tested in Florida, to be vaccinated in Florida. We will, of course, adhere to the recommendations from the Surgeon General of the state of Florida, my boss. And what we have developed is a few layers. So let me give you some information. We explored the data, and we found 911 individuals that are not residents of Florida that are in our databases that are already been vaccinated or they are going to be vaccinated. 522 are pending appointments. The state with the highest number of appointments is Michigan with 117, Pennsylvania with 106, Illinois 82, and every single state besides Alaska is in this list, and including Connecticut. When I came from, there are 18 people from Connecticut. I can assure you none of them are related to me, or I have made an appointment for them. So the challenge with these is that many of these people could be part-time residents of our state. And also, especially in Orlando, with the timeshares and other lodging infrastructure that we have, it's quite possible that people from Illinois, New York, Michigan come and snowbirds to our state. So now when you register in the portal, it's going to be three choices. Are you a resident, a permanent resident of the state of Florida? Are you a part-time resident of the state of Florida? Or you are not a resident of the state of Florida? And that will also filter some of the individual. Also, if you enter an address that is not an address in Florida, it will prompt that type of questioning as well. Now, we are going to validate driver's license or all the IDs and match it up with the individual. I don't think that we can do it for 2,000 individuals a day because it will slow the process, but we are going to frequently conduct audits of those who are coming so that we have a general sense of what is happening with that aspect. But we will honor those that were out of the state and got the first dosage with us. It's just a responsible thing to do. And we have that data. We know what vaccine they got. Although we provide them with a card, we will honor those. With regard to the second dosage, we got last week the 16,000 Moderna for a second dosage, and we also have in existence about 19,000 Pfizer that we will continue to give to our residents until we get new or until we run out. There is a possibility of, as you can see, I have watched the news at the national level. They are struggling with the production and distribution at the national level. So we could experience some of that here. So far, we have not. We have been very lucky, and we have vaccines for the next couple of weeks. Now, the next question is going to be, how many appointments do you have for those vaccines? So right now, we have a total of 58,333 appointments. 46,000 of those are for second dose, and about 13,000 that is still left in the system are for first dosage. As the mayor mentioned, the portal will be opening at 5 o'clock. And the idea that we have is because next week, most of the appointments that we have are for second dosage. So we want to add first dosage into the pile so that we have more work the weeks coming ahead. I think it's hard to explain, but because they overlap, we want to have first dosage and second dosage all the time so that we keep moving the population. With that, the mayor mentioned we are going to go up to 2,500 appointments a day because the cancellations have increased and the no-show ups have also increased. For that, we want to overbook to compensate for those who may not be coming for whatever reason. They got vaccinated, they forgot their appointment. But we also ask, please, if you know that you are not coming, cancel your appointment because that will open appointments for other individuals. The portal will continue to be open, but it's limited to next week. And why we are limiting to next week? And we will continue to be open. And as people cancel, those appointments will open and people will be able to make those appointments for next week. We want to keep it just for next week because as I think I expressed to you before, the longer you have your appointment, the more likely is that individual will cancel or not show up. So for that, we are going to reduce it to the week, the increases, so that we have a little bit of control with that. And also, because there are some instability in the vaccine distribution around the country, we want to control week by week what we are receiving in accordance with the shipments that we get from the state. So that's what we are trying to match. It's difficult, but so far we can make it happen. Another conversation that is happening online, newspapers and other mediums, is waste, vaccine waste. So again, what is vaccine waste? A vaccine wasted is a vaccine that you draw out of a vial, you put in a syringe, and you don't use it for whatever reason. Temperature, amount in the needle is not correct, you cannot pull again from another vial, so that could be discarded. The needle broke. If you can change the needle, that's possible, but if the vaccine the dose got altered, you cannot again put any new vaccine in that syringe because it has to come from the same vial. And we are drawing vaccines in advance so that we can speed up the process. The way that we do this is because we know every hour how many individuals are coming. We calculate what the cancellation rate was the day before, and based on that, we underdraw, but we keep a supply going so that the flow maintains. With that, we have been able to minimize vaccine waste to really a minimum. I mean, I can tell you that maybe in a day of 2,500 vaccinations, we could have 3 or 2 wasted. Now, that compensates also with the fact that what we are getting, the numbers that I'm giving you for Pfizer specifically, is on 5 dosage per vial, but we are extracting 6. So we actually in Pfizer are giving more than we received because it has an extra dosage, and that compensates for those small waste that we may experience. Now, at the end of the day, we also, if we have anything left, we offer to our employees who are not all vaccinated. We have offers to the EMS providers that are right now there. They are all vaccinated at this point. Some may have not. And we also have offered to the closest individuals that are working with us at the convention center because it's important to keep this site without an outbreak. If we have an outbreak there, it will be devastating for the site and for the entire community if we have to close because of an outbreak. So those are the steps that we are taking. It will be always transparent, we will be all honest, and we will give you the right answers when you ask the right questions. Thank you.
All right, Dr. Pino. Dr. Pino said he'll give you the answers when you ask the right questions. All right, we'll open it up for questions. Just as a reminder, if there's any Spanish-speaking media here, we have Commissioner Gomez-Cordero, who has joined us. She's fluent. She can help translate. We have Ms. Ilia Torres from my office, who can also help translate for me if we need to do so. And with that, we'll open it up for any questions. So the mystery mic, I'm not sure where it is. So it's over here. And it's Ms. Lauren Seabrook from Channel 9.
Mayor, hopefully this is the right question. Looking for the right answer here. Yes, this is for you today. I'm curious, Lauren Seabrook, Channel 9. I'm curious about, we've done stories in the past. I know I interviewed Danny about this. Orange County's been ready and waiting to be able to assist the Department of Health in vaccinating through Orange County Services and a lot of resources you guys have. I know that a lot of doses are now going to Publix that are being kind of split with our county, as well as I hear that there's some lawmakers that are trying to set up some churches to do some vaccination sites. Is Orange County being left out of this, or is there going to be a chance that you all will be able to help as well?
None of those sites can probably be as successful as they could be without some logistical support from local governments. They require support from paramedics or EMS personnel. They require support from law enforcement because when you run these sites, typically they impact local roads, and the communications between the state and the local governments, quite frankly, has not been what it should be. There are some politics at play here. Perhaps there are some legislators who feel that they have been somehow left out of it, and they are using their influence on the governor or the state to do these community-based vaccination points of contact. And generally speaking, all of that would be good, but it does require a coordinated effort. This weekend, for example, there will be two churches in West Orlando that will be offering vaccinations to persons 65 and older. However, those two churches are within a couple hundred yards or so, perhaps, of each other. In terms of ensuring underserved communities get the vaccine and that there's some equity, if you will, with whoever has access, I don't believe that it's a good fit for the decisions to be made based upon who you know. As the county mayor, through county charter, I become the emergency manager for Orange County, inclusive of the municipalities. And so my goal is to make certain that we have a comprehensive approach on the ground to what we are trying to accomplish here within our community. And sometimes when there's a lack of coordination, it creates confusion, perhaps it creates a bit of dysfunctionality that is not needed now. And so we continue to give feedback, positive feedback where we can, criticism where we must, but I'm not bashful about saying what needs to be said in this regard, because ultimately my goal in this community is to ensure that people have equal access to the vaccinations. And when politics gets involved in the process of it, inevitably somebody's going to get left out. Some geographical area is going to get left out. Some particular community-based organization is going to get left out, and perhaps in some ways some faith-based location is going to get left out if we continue, because then it becomes one special interest group after another, whereas looking at it holistically to make sure that all communities don't get left behind in this process. So that's frustrating a bit for many of us. Prior to this press conference, I had a regional conference call with the surrounding counties of Lake, Seminole, and Osceola County. And of course, Orange was the fourth county that was on the call. And several of the counties and their representatives expressed similar frustration that it seems like there's this desire to kind of go around the local level, and I just hope that the communications improves. Okay. Was that clear? Okay. Thank you.
Troy Campbell with Channel 6, questions for Mayor Demings. Does the county plan to also use the newly rolled out state health hotline for vaccinations that they're currently using in Miami-Dade, along with the online website? Are you even aware of that? And what has your connection or communication been like with the state on that rollout of the telephone hotline?
We have been in communications through our Emergency Operations Center. We've been under a state of emergency here in Orange County since March, and so the process requires us to communicate with the state, and we have done that. In terms of the website, it's my understanding that the state wants to first get it right, so they're rolling it out with some South Florida counties initially before it becomes available to all 67 counties. And so until that time occurs, we will continue with the process that we've used here. And Dr. Pino certainly can chime in because this is a state operation. While Dr. Pino is the medical officer for the Orange County Health Department, he is a state employee, and he will tell you he's not the state, he's an employee of the state. And we obviously work together very closely on a day-to-day basis here within our county. And he can tell you kind of the wisdom behind why the state has decided to roll out the new website in the format that it is doing so.
So on that, yes, I work for the state, but not the state. I work for the state to facilitate here anything that we do and everything. So with the rollout of the software, the application, so the state have a contract with an application called CheckCare, and they are implementing it across a few counties first, and then rolling it out progressively. We continue to be with CDR McGuire. That's a contract that the county established with that company for the testing side, but also was extended to the vaccination side, and it's working very well for us. So before we jump into anything new, we would like other people to work the kinks. And it's necessary other municipalities, we go through the same headaches and pain that we went through at the beginning, so we don't want to do it twice, that painful process. And it will happen and it will get better. So that's our second choice. Now, our department also have acquired a third choice. We're in the process of acquiring a third choice. In case that 1 and B do not work, we always will have C. It's an acquisition that we are doing on our own because it's also necessary for our clinics in the future. And it's the QFlow is the company that is doing it for the entire UK, and it has worked very well over there. So we are also acquiring that technology in case that these two may not work for whatever reason, but also for the future, because we see the future of people making appointments and everything online, and that's here. So we are acquiring that technology as well.
My question is for Dr. Pino. This is Eric Mock, Spectrum News 13. We've had several parents reach out to us about schools where many teachers are quarantining, dozens of students are quarantining, and yet the schools stay open when in the past we've seen some schools close with 7 quarantines, and they're just wondering and we've been told by the school district that it's up to the health department whether or not to close a school or not and how many quarantines to do. So what's the threshold now? Has it changed? And why are we seeing so many quarantines and schools continuing to stay open in some parts? So
about the closing, only the school board can close the schools. We have made recommendations in the past, and we will continue to do so. And Scott could expand on that. But with regard to a threshold, There is no one from our end, in the sense that the large number of people on quarantine is not necessarily an expression of severity of the outbreak in a specific place. And why am I saying that? Not necessarily, because you could have one person that was positive in an environment. Let's don't call it school, let's call it here. And if that person walks around all of us and talk to all of us, only one person could send all of us into quarantine. Because quarantine is designed to prevent new exposure into the setting that you are having. It's just an exhibition. So that number should not make reference or solely be used to guide the decision-making process. It's more also about who is positive, the number of people, and the ability of the school to keep functioning, even in those circumstances. But Scott could expand on that.
Thanks, Dr. Pino. Yeah, we work closely with the Department of Health, and clearly have taken their guidance when it's come to pivoting schools. What we look at is, as far as our staff quarantines, can we properly operate the school? Can we effectively and efficiently and safely continue to operate the school? If that means that we need to take a class or two and put them into a larger area in order to put them on the launch ed model for a period of time, we'll do that. What we try to do is to make sure that we have enough staff that we can maintain that level of safety for the school. Once that tipping point happens where the principal feels like that they cannot operate the school safely, they can't have the supervision they need, or they don't have the substitutes that they need to be able to fill those positions that are quarantined, then they'll look at pivoting. Our key is we want to make sure that we're not reacting and over pivoting a school, that we're sticking to the quarantines that the Department of Health are issuing, and that we're making sure that we're making good, sound instructional decisions to keep that continuity in the instruction there, but still the safety and security of our students at the same time. And it's a balance, and we're striking that balance every day.
Paul Rivera, Channel 2. Dr. Pino, this one is for you, and then Mayor Demings, if you also would like to comment. President Biden had said that one of his plans were to create FEMA-supported vaccination sites, said that sports stadiums might be used. And when you think about Orlando, you think Amway, Camping World. Has the Biden administration spoken to you all yet? Is that something that you would support, and can that be done here in Orlando?
No, no one has talked to me about it. I don't expect it to be. That's a federal decision. Those would be FEMA sites. It would be great to have it if it's placed in the right place under the right circumstances, so that it's a regional site probably, and that will attract a lot of people into our county, so that have to be a consideration. But of course, any increase in the vaccinations, our county will be welcome.
Last week, I believe it was Friday, I participated in a national conference call with the Biden administration, and there were county mayors, executives. In some places, they're called county judges, they're called county presidents, but it was county leadership from around the country, from some large urban counties that were selected to participate in a dialogue. Part of that conversation was about local governments continuing to receive direct allocation, about the necessity for coordination of any relief or stimulus dollars that will be allocated. And what was said from that call was that there would be outreach that will continue, and obviously we're within just a few days now of a new administration. So it's going to take time for the details to really be worked out, specifically how this is going to happen across the nation. Of course, the president said that his goal is to ensure that within his first 100 days, he wanted to inoculate 100 million Americans, which is just under a third of the American population. and that means about 1 million doses a day would be administered. At this point, we're nowhere near that number, so we do anticipate that the availability of the supply will catch up here very quickly, and that seemed to be one of the themes from the call, was that the stockpile of available vaccine within the country, they had a plan to increase that. We've been now vaccinating residents for the last month, perhaps, or somewhere around that period of time. And there are learning curves that have been developed about where there are flaws in the logistics associated with this and the coordination, and there are learning points. The state has been keeping data about how this has worked in the respective counties, and they've learned from that too. So by the time that we have mass availability of the vaccine, we should all have our acts together. Our very talented team here within Orange County has been working across jurisdictional boundaries. We've been working with Dr. Pino and his staff, and we have contingency plans in place. We've been working with the private sector, with our hospitals, and some other healthcare providers. And I believe that we have a very robust plan if we had ample supply available in this community. So that's the good news for our community. I know that some people want to get it sooner than later, but the projection is that by really mid-February, we should be firing on all cylinders at that point. Absolutely. We're going to participate. We're going to work with the state. We're going to work with the federal government. We're going to work with our municipalities and, again, our entire community to make sure that there's no demographic that gets left out of this process. I guess the good news is that a lot of people do want to get vaccinated.
Megan Cruz with Channel 9. This is for you, Dr. Pino. So, Dr. Pino, we just found out that hospitals will no longer be receiving first doses from the states, and instead those doses are going to go to government-run facilities. So do you know how many more additional doses that would mean for Orange County and when you could be receiving those? And then also, hospitals were allowed to give doses to people under the age of 65 if they were deemed extremely vulnerable to COVID. So will the county-run sites begin doing those?
So with regard to the county-run site at the convention center, it is designed in a way that is designed for speed, to move volume of people. So what we are doing with the EMS providers in the county and municipality is more targeted vaccination for sites where you can encounter individuals with lack of mobility, challenging in transportation issues, as well as low socioeconomic status. So for those special groups, we prefer to go where they are than they coming to us. Now, the hospital were able to do that also because they did it only for their own patients. So they know the clinical history and everything about these patients, that they were able to send an email to those specific individuals to get them registered. Eventually, we will have to get into the business of younger than 65, but we have about more than 200,000 over 65 years old in our county, so we have a long way to go before the convention center site, and this is notwithstanding any changes that may happen in directions that we get from the state to get younger than 65. But that setting is a little bit complicated for that type of corroborating who is who, what conditions you have, are you authorized, because that will slow the entire process. So we may come out with different ideas to be able to accomplish what you just said. And regarding to the first dosage, I haven't seen those news. I've been here, so I don't know about that one. But also remember, the state is diversifying who is giving vaccinations. There is the CDR MyWire, the same company that we are using is going to start doing assisted living facilities around our county. They have done others. We are doing congregating housing, mobile homes, and that type of a structure. We are identifying other locations through EMS providers that we will be able to go through. We also develop a risk index where we will categorize places based on priority that they need, based on number of deaths in the area, how the census tract performing, positivity rate, and other data analytics that we decide then in which order the sites will go. But the main issue right now is that we have a limited supply of vaccines. And have these sites diversified, the Publix and other places, we are right now all eating from the same piece of the pie. It has not increased significantly.
Lara Greenberg, Fox 35. This question is also for Dr. Pino. Dr. Pino, you mentioned the increase in daily appointments and overbooking to deal with the no-shows that are happening. Can you speak to if there have been vaccines that have gone wasted, and if so, how much?
So I don't have the total number, but I can really tell you that out of the thousands of vaccines that we have given at that place, very few has been wasted. You know, what happens sometimes, especially with Pfizer, because Pfizer is clear like water. And sometimes you are looking at the syringe and you think the syringe is empty. Also, you know, syringes have a little bit of air that you have to get out. And if the nurse is not careful, it could squeeze the entire, because it's very small, it's 0.3. So it's very small amount of the vaccine. So that had happened. And we are not able to refill that syringe because that vial has been already used and that has been discarded. Now, we have not adequately accounted for it, meaning in detail. Now, every station has an inventory sheet where they will track if this waste happened, because we may have to retrain those nurses on how to do that in a safe mode, and et cetera, et cetera. And at the end of the day, some days we have a couple of vaccines. So maybe in the future I can give you a full account of what has been discarded. I prefer than wasted. But yes.
This is Melissa Thomas of Florida National News in the back. This question is for Mayor Demings. Obviously, you mentioned the phone call you had with the Biden administration in terms of the federal plan. Just kind of give your thoughts on the presence of a federal plan now, like the fact that one is coming into place in comparison to the previous administration, kind of what your thoughts are on being on that call with the different county leaders across the country.
The details are still to be worked out, but at least we do remain optimistic. The incoming administration has promised to move swiftly with those details, but as we all know, the devil's in the details. But there is certainly this commitment that we're seeing with a specific number of individuals to be vaccinated. So until we get to that point, I will remain optimistic about it. The call had almost every major county, city, area within the country was on that particular call, from West Coast to the East Coast and in between. And there were very poignant questions that were asked, statements that were made, and feedback that was given so that the administration will understand our needs from a local perspective. You've heard me say this before, that this is where the rubber meets the road. People live in local communities across America, and perhaps I believe that the people who live in those respective communities know best about how to reach people in their communities. If I were trying to work out the logistics for the entire nation without consulting the individual communities, I think that would be an ingredient for failure for the rollout. So what the administration was doing was recognizing this need to have cross-pollination between the federal, state, and local governments if they're going to be successful in this initiative.
Dr. Pino, Ryan Gillespie at the Orlando Sentinel, kind of to that same point, with kind of these changes that are being discussed or implemented at the federal level, has any of that flowed down to you yet, where you are changing protocols or anything like that here at the local level, or are there things that you're anticipating that could be coming down the line in the next few weeks, months, anything like that?
No, I have no experience any changes in direction yet or how the plans are going to work. I have not seen any documents, but I expect that the CDC will quickly gear up and forward those ideas and the communication. Also, if you allow me, because I forgot to mention and insist to our employees of the Orange County Public Schools that are having the close pod this weekend, it is important for you to be there between 12 and 4, because initially we had planned from 12 to 7, but we have not received a large number of appointments for that day. So we are going to reduce the number of hours, not to have the site open for too long unnecessarily, in the sense that it's very expensive to run that site, and every time that it's open, I have to have over 100 employees, all the energy and the resources that I use. So it's important for the employees of the Orange County Public Schools that are going to be vaccinated on Sunday, that you are over 65 years old, that you have an appointment and bring your QR code, and also you bring your identification as part of the school, and be there between noon and 4. Thank you.
Okay.
The RNs and LPNs, Dr.
Yes. Yes, the nurses and LPNs of the system will also be vaccinated, and they have to bring their license. Thank you, Scott.
If there are no other questions, just as a reminder, our next briefing will be on Monday, January the 25th at 4:30 p.m. We hope that you stay well and safe over this weekend.